But anyway, we continue with pediatric glaucoma. We saw, I think it was called congenital glaucoma, and we'll deal with pediatric.
Thank you. So I'm very grateful for the invitation and opportunity to talk to you guys today a little bit about pediatric glaucoma. And just to give you a little background on my training and qualifications, I'm also not a doctor, so I actually don't administer any treatment for glaucoma. But I do work very closely with our pediatric glaucoma specialist at Bldg, Alex Levin, and I work with many families to sort of give them a better risk assessment and to help them identify any genetic causes for why their child has glaucoma so early. Okay. I guess I use this little thing. Okay. There we go. So just to give you a little comparison between pediatric glaucoma and adult onset glaucoma. In pediatrics, the prevalence or the occurrence of it is 1 in every 5,000 to 22,000 children, which is a pretty big difference and makes it relatively rare in comparison to adult onset glaucoma, which is about 1 in every 110 individuals. And the reason for such a wide range in the occurrence in childhood is because there are multiple factors that might contribute to it, including the cause and then across different ethnic backgrounds. And there are also many different reasons why a child could have glaucoma. And some of them do overlap with why adults can get it, and those include trauma to the eye, medications, long-term use of medications with steroids, systemic and ocular issues that can cause inflammation of the eye. And then the two more common reasons we see children with glaucoma are lens extraction or cataract surgery and genetic predispositions. So when we're referring to genetic childhood glaucoma, this is an inborn error or a malformation of that draining system of the eye. So this is something that's present from birth. That drainage system never properly formed correctly, and so it can't properly drain that fluid that accumulates in the eye. All right. The signs and symptoms of childhood glaucoma, there can be certain symptoms depending on the age of the child. So in children that are 5 years of age or younger, and in infants, you may see a couple things like frequent tearing or watering of the eyes, even in the absence when they're not crying. You would also see this with sometimes the eye begins to look a little cloudy and begin to look a little whitish, and you are unable to see clearly the pupil and the colored part of the eye. Because children at this young age have such an elastic eye, when the pressure inside the eye begins to build, their eyes can begin to expand and kind of give to that pressure, and so the eyes may have a larger appearance and kind of look like they're growing a little faster. And these kids can also have a greater sensitivity to light. So when you notice they're out in bright lights or in the sun and they're squinting a lot and they're not happy, that could be another indication to take them to the eye doctor. And then on exam, the doctor can actually measure the pressure to see that it's increased. And even just looking very closely through that slit lamp to see if they focus on the color part of the eye, they can see characteristic changes there that indicate this child probably has glaucoma. And then children older than 5 years of age and in their teenage years almost never have symptoms just like adults. So that just kind of reinforces the importance of getting an eye exam every 1 to 2 years. I'm not going to comment too much on treatment, also because I'm not the one who gives it, but it is very different than in adults. There are different operations, and the procedures of the operations may be a little different for children. The rules in treating with medications is a little bit different because children are not just mini adults. They are very different physiologically, so we have to consider their age in their treatment. And then thinking about the child as the patient. They're not going to be as cooperative as a grown-up is when they're sitting in the chair. And so compliance can be an issue. And the younger they are, the less compliant they're going to be. And you know, particularly if they have that sensitivity to light, they're not going to want to let a doctor shine a light in their eyes to get a good exam. So often these kids have to come in for examinations under anesthesia where we put them to sleep and the doctor can get a really good look inside, do all the investigations and measurements that they need to do to be able to treat and control the glaucoma in the child. And because of this, it does involve the whole family. A lot of responsibility for the treatments and keeping up with follow-ups is going to fall on the parents. When there are other siblings involved, it may mean multiple children who have glaucoma in a family. And for the siblings who don't have it, they may feel that maybe their sibling who has glaucoma is getting a little more attention. So there are multiple factors that impact the entire family. And also, glaucoma is a lifetime condition. So once a child has it, it's something that they need to be screened for and followed with throughout their lifetime. And you know, the life expectancy in medicine gets better and better. The lifetime for the kids that we're seeing in the office today very well could be about 100 years. All right. So cause equals treatment. Understanding exactly why the child has glaucoma is really going to dictate how the physician's able to treat the child and keep their glaucoma under control. So again, just to list the different reasons why a child can have glaucoma. Maybe they have trauma to the eye, maybe they've been on long-term prescription steroids for something, and then trying to remove that external factor that might be contributing to the child's glaucoma. You know, a child who's on prescription steroids, it may be for a very good reason, so that also requires open communication across multiple physicians in that child's care to make sure we're weighing all the risks and benefits to make sure they're getting the proper treatment for everything that they need. And then again, just to reinforce, the more common reasons that we see children with glaucoma are, one, from cataract surgery when they don't have a lens left in their eye. Again, because children are not like adults and their eyes still have a lot of growth and development to go into, they don't always use intraocular lenses, and so that front part of the eye and all the structures are disrupted. And then genetics. So what does genetics really have to do with it? As opposed to adult glaucoma, when we see glaucoma in children, there's most likely a genetic predisposition for it. And we also have better knowledge about single genetic traits that can cause the glaucoma in a childhood. So I work with families to give them a genetic risk assessment and to inform them about genetic testing options that may be available to them to identify the true cause for glaucoma in their family and to help identify other at-risk family members. So for the sake of time, I'm going to skip through this stuff, but if you have any questions later, I can go through it a little more in detail. But what I will reinforce is just to remind you that DNA is kind of the master code in all living things. It's like a master code of instructions for how every structure in our body, our eyes, our nose, our ears, our heart, our lungs, how everything is formed and how the health of those organs are maintained throughout our lifetime. And genes are just segments of that DNA that might code for one specific trait or a small group of traits. And that's what we're focusing on when we do genetic testing. So some of the common genetic glaucoma conditions that we see in our clinic, one is primary congenital glaucoma, which has been mentioned multiple times today. It is present at birth, and it's usually not associated with any other health issues. It's also not associated with other abnormalities in the eye. It's mostly within that draining system. And if it's diagnosed after infancy or after birth, but before the first 4 years of life, it does kind of fall into the same spectrum of this diagnosis, but we refer to it as infantile glaucoma. And the one gene that has been associated to cause this in some families is called the CYP1B1 gene. And that's just a fancy symbol that scientists decided to name this gene. And it's one gene that we can test for to see if we can identify the abnormality in this gene for a child that is presenting with this diagnosis to give the family more information of where this came from. And I comment here that it's inherited in what we call an autosomal recessive pattern, and what that means is both male and female children are at equal risk of inheriting this type of glaucoma, and they have to inherit the trait from both parents. So they sort of get a double dose of that genetic abnormality that predisposes them for glaucoma. The other type of genetic glaucoma that we see in children is called juvenile open-angle glaucoma. This does also overlap with primary open-angle glaucoma. And this can be diagnosed anywhere between 4 years of age and 40 years of age, and it's still considered this genetic form of early onset glaucoma. And this condition, again, is also due to a mutation in a gene that's responsible for that proper formation of the drainage system in the eye. And when there's a mutation in this gene or an abnormality in this gene, it can't properly give the instructions to make sure that drainage system forms correctly. And so these people are also at risk for glaucoma. And this is inherited in a dominant pattern, which means that you only need to have a mutation in one of your copies. An affected parent can pass it to each child, both male and female. It doesn't depend on the other parent of the child in order to have the disease. So I'm going to give you a couple images, and I warn you, some of them may be striking, and if any of them are a little upsetting to you, feel free to look away. But there are other rare forms of genetic glaucoma that are involved with other genes that are instructions for how other parts of the eye are formed that can affect how that drainage system works. So this is a picture of a little infant, just a couple days old, that presented to our office with congenital glaucoma. And the eyes are a little bit cloudy, just like primary congenital glaucoma, and probably slightly bigger. I think they measured a little bigger than normal for an infant of this child's age. And one thing that's different from this child than kids who have primary congenital glaucoma alone is that this baby is also missing the colored part of the eye. The iris did not form at all, and so that structure is completely missing from the eye. And that's part of a genetic eye condition called aniridia, which can affect how multiple different parts of the eye form, and one of those differences can predispose children for glaucoma. And this is just another example of how variable that iris malformation can be. So this person also has aniridia, but still got some of the colored part of their eye and just has part of it missing. This person is still at the same equal risk for glaucoma as the baby you saw in the previous slide. This one is an interesting picture only because this person only has it in one eye, so you have the normal eye to sort of compare and see the differences. And this is a different genetic abnormality in how the structures of the eye form, called Axenfeld-Rieger. And those are basically the names of two doctors who sort of describe this difference. And it's also a different way that the iris has formed that predisposes people for glaucoma. I believe they're at 50% lifetime risk. So even though a child is getting screened and may not have developed glaucoma, they're still at risk for developing glaucoma throughout their lifetime. And then this is just another one called Peters anomaly, in which the iris and the cornea, which is that crystal covering over the colored part of the eye, fail to divide and become two separate structures. Some form of treatment in these individuals is they may be eligible for corneal transplants to sort of clear up that part of their eye so that they're able to develop vision and see better. But they also remain at a 50% lifetime risk for glaucoma. And there's various numbers of different genes that can cause these different eye differences, and each one of them run through the family in a different way. And can cause different things, and sometimes they're also associated with other health problems. So genetic testing can be extremely informative for these families when we see a child with one of these things. It is available and it's helpful when we get a positive result. But a lot of our families, I would say 50% of them, do not find anything on these genetic tests, and so we're still left wondering exactly what is the risk to other members of the family, and what is the cause for this. So we know that our knowledge about the genetics of glaucoma is pretty limited, which raises the importance of research. And I think one of the ways research can advance our knowledge about glaucoma is to better understand the genetics that causes it, and even also with adult onset glaucoma, because the more we know about the genetic factors that contribute to it, the more we might be able to tailor treatments to target that specific cause for your glaucoma and make it more individualized in your course of treatments, which we kind of call personalized medicine. So the genetic tests that are available today are not appropriate for everyone. So it does require a really good eye exam by an eye specialist to determine whether somebody could have one of these genetic forms of glaucoma and whether genetic testing would be informative for you. Sometimes it also involves a good physical exam too, and also a detailed personal medical history as well as a detailed family history. And in these, all these factors and things that we collect kind of help us provide families with a good risk assessment, and we use that information to also help us interpret any genetic test result that we may get back. So what are the benefits of genetic testing in the setting of childhood glaucoma? Well, one, a positive result can provide answers to a family as to why. Why did my child get glaucoma so early? It may also provide more prognosis information. Are there other eye abnormalities that the eye doctor should be looking for? Are there other health problems outside of the eye associated with my specific genetic abnormality that my child needs to be watched for? And then it, again, helps us determine what is the pattern of inheritance. Helps us identify other at-risk family members who should probably be screened a little earlier, even before adulthood. And also tell family members and couples with a child, what are your chances of having another child with glaucoma? And then it can also sometimes provide insight to physicians who are treating the child and help them decide what is the best course of treatment for this particular child. And beyond providing all this genetic information, it's also important to provide the emotional support to these families because it is very involved. It's a lot, and as the speaker before me mentioned, it's, it can be very stressful. And so sometimes as the medical professionals involved with these children's care, we kind of ask the families, what is it that we can do to take off your plate to make things easier for you? And one of the things that many of the families I work with, that they just want to connect with other families that are going through what they're going through. They want to meet other children who have glaucoma so that their child doesn't feel they're the only one. And so one resource of information and networking we provide our families is the Pediatric Glaucoma and Cataract Association, which is a family-organized organization. A bunch of families up in Canada decided to come together and form this group that has now become part of Canada and the U.S. To provide an accurate source of information about pediatric glaucoma and cataracts. It also provides a good place for families to network and meet other families. And it also provides an online forum where patients can enter questions at any point in time, even when they're not in the physician's office, and be able to get an answer back from trained professionals who work with childhood glaucoma. So that's about it. Thank you for your attention, and if you have any questions, I'm happy to take them.
Sorry,
I might have to leave. I have to leave soon.
Okay.
So I apologize.
Question? We will move on.